talk about the vaccine, more about all of these issues. Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. And you've been here for us since the beginning of this pandemic, and we genuinely appreciate your expert advice, all your insight, all of it. We really do, Doctor. All right, so the past few days, we've seen the number of new COVID-19 cases begin to decline in Massachusetts, which is a good thing. It is still around 4,000 every day. Beginning next week, Governor Baker says he's going to lift the stay-at-home order and the curfew on businesses like restaurants. What are your thoughts on the timing of all of this?
So this is good news, Maria, but, and there is a but, I am concerned about that second peak, what I'll call a twin peak. I'm sure that was one of your favorite shows in the early 90s.
It actually was.
A guilty pleasure. I know. So the reason I say that is because, remember, we still have a lot of winter ahead of us. People are indoors. We're hearing about more variants, more contagious virus. So I am concerned about that. Is it possible we'll continue to go down steadily? It's possible, but I doubt it. So I think we have to be prepared. Remember, you know, we want to hope for the best, prepare for the worst.
And let me pick up on the fact that we report numbers every night, Dr. Ellerin, but let's talk about hospital capacity, for example. New cases may be falling, but here's the question. Are you seeing fewer patients that need hospitalization? And what's the situation with ICU?
Okay, so Ed, we're seeing fewer patients that require hospitalization right now, and we're discharging many of our COVID-19 patients faster. But in the ICU, that's a little bit of a different situation. Right now, we have a census of 30, where 12 of them are COVID-19 patients. Normally, at this time, we'd have a census of about 19. And when you look at intubated patients, right now we have 21 intubated patients, and 12 of those are COVID-19 patients. Normally, we'd have about 10 less. So in the ICU, it's very busy right now.
President Biden signing these orders to speed up manufacturing and distributions of vaccines. And you've heard this promise, and Dr. Fauci just confirming that. 100 million vaccines administered in 100 days. Doable, they say. But what's your discussion among colleagues? Because is the supply even there to make that happen in such a short window?
It's an ambitious plan. Look, we've had about 16 million doses in our arms so far, okay? And that's been around 1 month. So if you add 2 months to that, we're around 50 million projection. We have to try to double that. If we can get one more manufacturer, one more company like J&J into the mix, I think we're going to be able to do that. But I like how Biden focused on capacity, logistics, and trust. And I think with those three things, that's a plan for success.
So let me ask you one very specific question. You know, everybody wants to know the answer to their question. And a viewer sent us in this question. She says her husband is 80 years old and he's at high risk. She's 70. She's healthy. She has no known comorbidities, meaning that she may have to wait a little longer for her vaccine. So she wonders, why doesn't the entire household get vaccinated at the same time rather than just the at-risk person?
And of course, that makes sense, right? The problem is the demand so far exceeds the supply. So right now, remember, she and her husband are both in that phase 2 category. Him being greater than 75 years of age, he may get the vaccine before she does. But ideally, we'll be able to figure this out with the, with the new plan that's coming out.
Dr. Fauci, by the way, Dr. Ellerin said just a few minutes ago that maybe by the fall we can be knocking on the door of normal life. Do you agree?
I think it's possible. Let me just say one thing about our system here. We vaccinated over 2/3 of our staff and with the first dose.
Right.
And we're already starting to see significantly less staff getting infected. So that's a good sign. It's still early, but very promising.
Very good. Dr.
Indeed.
Ellerin, great to hear from you.